the Communications Coordinator for Birth to 5 Illinois. Welcome and thank you for attending the Early Childhood Statewide Needs Community Webinar. This webinar offers American Sign Language interpretation. The interpreter's video will be pinned for accessibility for the duration of the meeting. However, participants' videos will not be on. The chat box is open should you have a question or if you're having technical difficulties viewing the interpreter's screen. For our Spanish speakers, we will be offering live Spanish interpretation. We are going to pause now for instructions from our interpreter.
Lindsay, you're
not hearing. I'm sorry, is this Lindsay?
Apologies, everybody. There seems to be a technical difficulty on our end listening to the interpreter's instructions. So very briefly, let me just review what she was saying. At the bottom of your screen, if you were on a desktop shown right here on your presentation screen, there's a globe icon. If you will click on the globe icon, a menu will pop up that you can select your language, either English or Spanish. Please select one of these so that you can hear that language throughout the presentation. If you are on a mobile device, the same idea, except you'll click the three dots found in the upper or lower right of your screen. The More menu will appear. Select the language for interpretation. Select English or Spanish. If you'd like to turn on closed captioning, click the CC icon at the bottom of the video. This will turn on the captions. If you want closed captions in a language other than English, click on the gear icon for settings, click on subtitles, then auto translate, and you can scroll down to pick the language you want. This closed captioning is being provided by Zoom. We do apologize for any errors. This recorded session will provide an overview of methodology and some findings from the Birth to 5 Illinois Early Childhood Regional Needs Assessment statewide report, as well as talk about the strengths, needs, and recommendations for improving access to and enrollment in early childhood education and care programs in the state. Members of our Birth to 5 Illinois state team will give a brief presentation, and then we will open it up for questions. While the chat is open, we ask that all questions you would like to be read aloud and answered by the Birth to 5 Illinois team be submitted into the Q&A box at the bottom of your screen. Once we get to the Q&A portion of this session, we will be answering questions first that were submitted to us via the registration form for this event, and second, questions that are submitted to us during the via the Q&A box. All attendees are currently muted. However, you can find the raise hand function at the bottom of your screen. Once our initial presentation is over and we transition to live Q&A, we will allow for live questions. Please hold on raising your hand until the live Q&A. Finally, we will not be giving any certificates for attendance during tonight's session. And with that, I will pass it to Cicely to get us started.
Thank you so much, Sophie. Good evening, and thank you all for joining us. My name is Cicely Fleming, and I'm the director of Birth to Five Illinois. I use she, her pronouns. In 2021, the Illinois Commission on Equitable Early Childhood Education and Funding issued the report that you see on the left with findings that highlighted the inequities in the early childhood funding in our state of Illinois and the need to create a better statewide infrastructure to support early childhood professionals, expand services across the state for families and caregivers, and increase enrollment in our early childhood programs. The slide you see, the picture on the left is the cover. Hopefully you all have had a chance to read it for our statewide report, which we will present on tonight. Next slide, please. Birth to Five Illinois is comprised of 39 regions across our state. Each region is staffed with 3 staff members who are actually from the community. So they live in the region in which they represent. These regions do have action councils and family councils. And currently we have over 1,200 people who are actively involved in both of those. The regional needs assessments that were done throughout the 39 regions were produced earlier this summer, and they focused on the importance of addressing racial inequities and the need to include local voice in conversations that elevate the needs of the regions to state leadership and funders. This presentation is going to provide you a summary overview of those 39 reports and highlight for you some themes we saw. Next slide, please. Here's a snapshot of our staff. As I mentioned before, all of our staff do live within the region they represent, and we have a diverse staff. We have former teachers, we have former therapists, we have parents who have engaged in the system in the past and who currently are engaged in the past, people who used to work in school settings, as well as home care providers. We're really fortunate to have such a dedicated team across our state. And I forgot to mention, we have 3 staff in each regional office. Hopefully you've engaged with them, or you will do so after this presentation. I'm going to now head this over to Sonia, our Director of Operations, who's going to take you through the next few slides.
Thank you, Cicely. Good evening, everyone. My name is Sonia Clark. I use she and her pronouns, and I am the Director of Operations here at Birth to Five. And so we'll kind of get started with our mission that we live, breathe every day in our work, which is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We support the mobilization of communities to build and sustain equitable access to inclusive, high-quality early childhood services for all children and families in the state of Illinois. Next slide, please. Which brings us to our mission, and what we strive for is we envision that our work will help all stakeholders reimagine a more equitable early childhood education and care system that respects both family and community voice and works to ensure it is centered and prioritized at every level of decision-making in Illinois. Next slide, please. Which now brings us to our 3 main values and goals. So first, we must prioritize family voice that is centered on authentic family and community engagement. We will address inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Secondly, we must address the racial inequities that exist in our early childhood education and care system. And in that effort to move our early childhood education and care system to one where racism no longer impacts a child's success, we will work to dismantle barriers that have limited access to those high quality services for minoritized children in every corner of our state. And thirdly, we use the collective impact model to shift the current early childhood system in order to influence policy and funding at the local, regional, and state level. We will use community-driven feedback to build a system that harnesses knowledge that comes directly from families and providers and encourages decision makers to ensure new and/or expanded services are created to meet community needs. And now I will pass it over to August, who will discuss data and community input.
Hi, everyone. My name's August Stockwell. I'm the data coordinator. My pronouns are they, them, ella. Regional staff gathered qualitative data from community members, agencies, and organizations through council meetings, interviews, focus groups, listening sessions, and town halls. There were 205 town halls and listening sessions with over 3,500 attendees and 238 focus groups with 1,445 participants. Regional teams conducted 525 interviews with early childhood professionals, faith leaders, service providers, families and caregivers, and other community leaders. A survey was provided to regional teams so they could engage with those who are unable to attend a focus group, interview, or community listening session. 364 paper surveys and 212 online surveys were received. From July 2022 through June 2023, regional teams met with over 200 local, county, state, and federal elected officials to advocate for their communities and held or attended over 1,300 community events to engage with caregivers, families, children, and professionals. Each engagement provided an opportunity for community members to learn more about Birth to 5 Illinois and talk about the strengths, needs, and opportunities to strengthen the early childhood network for the region. Quantitative data was pulled from and provided by several state partners, including the Illinois Early Childhood Asset Map, Illinois Action for Children, and the Illinois Network of Child Care Resource and Referral Agencies, and others. Next slide, please. Family Council and Action Council members also provided essential community input. All the data was presented to Action and Family Council members during meetings, where everyone had the chance to reflect on what the data means to their community and the region, and discuss their own personal experiences engaging with the early childhood education and care system. A total of 629 people served on our Action Councils, and 471 people chose to remain on the Action Council for year 2. The tables on this slide show the breakdown of each council type by their gender and by race and ethnicity. Most Action Council members in year 1 reported their gender as being female, 54 reported as male, 2 as non-binary, genderqueer, or gender fluid, and 39 did not specify their gender. Most of the Family Council members also reported their gender as female. 17 reported as male, 4 as non-binary, genderqueer, or gender fluid, and 3 did not specify their gender. Both Action and Family Council groups predominantly reported being white, but there was a range of racial and ethnic backgrounds, including Asian or Pacific Islander, Black or African American, Hispanic or Latine, Middle Eastern, multiracial, and Native American. And next we'll hear from Leslie, who will be sharing more about the Action Councils and the Council's experiences during year 1.
Thank you, August, and good evening, everyone. My name is Leslie Price, and I'm the data strategist at Birth to 5 Illinois. My pronouns are she and her. Action Councils are comprised of a wide range of local stakeholders in each region, including early childhood education and care professionals, teachers, school district officials, early learning advocates, healthcare providers, faith leaders, elected officials, and other community members. Additionally, each Action Council reserves 2 seats for caregivers of children ages birth to 8 years old, to ensure that family voices are included in every meeting and discussion. From September 2022 through June 2023, 174 Action Council meetings took place across the state. Between June 2023 and August 2023, regional teams held events and reached out to community groups to recruit new people to our Year 2 councils. To join the councils, an interest form was submitted and then reviewed by a team comprised of both state and regional team members. Names and contact information were removed from each submission, and an equity matrix was applied to interest forms to allow reviewers the ability to see how each person's experiences and perspectives aligned with the work of the councils. The anonymity of the submissions, along with an impartial scoring system, was intended to mitigate bias and ensure that councils were diverse in terms of geography, race, ethnicity, gender, role, and sector, and the perspective they could bring to the councils. Those who replicated a perspective, geographic location, or demographic were asked to support our work in other ways, such as participating in an upcoming survey, focus group, interview, or as a community partner. We know that early childhood systems change can't happen without the involvement of early childhood professionals, along with community leaders and people from other roles and sectors. This year, we were intentional about recruiting people from diverse roles and sectors to help support the development of action plans, which build off our early childhood regional need assessments. And the data discussions councils will begin early next year about infant and early childhood mental and behavioral health. On the screen, you'll see some highlighted roles and sectors that comprise our action councils for Year 2. 249 Action Council members work in Head Start, Early Head Start, Prevention Initiative, Preschool for All or Preschool for All expansion programs, early intervention, or are a licensed child care or family friend neighbor care provider. 165 are from a local CCR&R or belong to their local collaboration. 57 are local, state, federal, or school elected officials or a member of their staff who represents their office. 44 are mental and or behavioral health, county health department, or healthcare workers. And 20 work as infant or early childhood mental health consultants. Having voices that represent diverse perspectives will continue to help us build an early childhood system that serves the whole child and their family. In late spring, we surveyed council members about their experiences serving on the councils. 82% of all respondents rated their experiences great, which was the highest rating. And 83% answered that they were very likely to recommend serving on the council to someone else. We also provided space for people to tell us more about their answers, and we chose a few of their answers to share with you today on the screen. Overwhelmingly, people shared that the councils were a catalyst for change in their community, and they really appreciated being invited to serve on the councils. We are so grateful to our Year 1 council members for their contributions and look forward to working with the new members across the region in Year 2. Our next speaker, Melissa, will talk more about the role of families and caregivers and the Family Council at Birth to 5 Illinois.
Thank you, Leslie. Good evening. My name is Melissa Williams. My pronouns are she, her, and I am the Family and Community Engagement Coordinator with Birth to 5 Illinois. The experience and knowledge that families, caregivers, and early childhood professionals gain while navigating the complexities of the state's early childhood education and care system are valuable. And understanding their lived experience in the local context is vital for decision makers to ensure communities have access to the programs, services, and supports they need. To this end, Birth to Five Illinois was created to harness family and caregiver voices and to serve as a bridge between the communities and the policymakers so that families, caregivers, and professional experiences can guide the decisions made to expand or enhance early childhood education and care services across the state. One family in Northern Illinois commented that childcare costs shouldn't be more than their mortgage. While this is just one example of family voice, stories shared around the state often follow a common theme. Birth to Five Illinois collects family voice in a variety of ways. In addition to focus groups, surveys, and listening sessions, we also provide a welcoming space on our website for parents and caregivers across the state to share their family stories of early childhood education and care, challenges, and successes. We invite you to visit the page and read the family stories shared. The link to the family stories page is shared in the chat. If you would like to share your story, there's a link to the family story submission page on our website in the chat as well. We would love to tell your story. Another way that Birth to Five Illinois harnesses family and caregiver voice is through the regional family councils. The family councils are comprised of parents and caregivers from a variety of settings and family types. Those include single parents, adoptive and foster parents, caregivers of relatives, children born to parents aged 19 and under, two-parent families, parents of children with disabilities, multi-generational families, and more. Each region had a selection committee that reviewed interest forms and made recommendations based on full consideration of a submitter's role, their sector, their location within the region, their race, ethnicity, gender, and their answers to open-ended questions. To ensure that the process was diverse and equitable, special emphasis was placed on outreach efforts to states' priority populations. Between September 2022 and June 2023, a reported 376 family council meetings occurred. Birth to Five Illinois had a total of 449 parents and caregivers who served on the Family Council from September 2022 through June 2023. Of those, 350 will be returning for the council for year 2. In summer 2023, 663 people submitted Family Council interest forms. Of those, 456 people were invited to serve on our Family Council for year 2. There were several factors that contributed to the difference between the number of interest forms we received and the number of people invited to serve on the council. These include the fact that there were a limited number of available seats based on those families who were returning for year 2. Some of the submissions were found to be ineligible, and others just simply declined to participate when invited. So now I will turn it over to Siobhan, who will share information about Illinois' early childhood education and care workforce.
Thank you, Melissa. Good evening. My name is Siobhan Parker. I use she, her pronouns, and I am the Assistant Director of Birth to Five Illinois. Regional teams work to understand the landscape and needs regarding ECEC workforce. Acknowledging the state has vested dollars in educational support resources into increasing the pipeline of educators, the team tried to understand additional community level barriers and needs regarding building the workforce. Throughout the state, a lack of diversity in teaching staff was of great concern. Community members voiced a desire to see teachers that represented more diversity in various categories, including racial/ethnic, language, gender identification, and age. Needed supports for the workforce was also another high priority concern across the state. Not only financial, but healthcare access, mental health supports, professional development, and retirement. A superintendent that sits on one of our councils stated, "We owe it to our children and their future to invest in childcare. Childcare is not only critical to our workforce and economy, but to prepare our next generation for success in school and later in life." I will now turn it back over to our Director of Operations, Sonia Clark, to talk about the statewide findings for early childhood education and care programs.
Thank you, Siobhan. All right, so when looking at early childhood education and care programs in Illinois, we know that they are made up of a variety of program types across a diverse range of service delivery options and across an array of settings. We focused on data that was available to us, publicly available data at the time, which was 2021 data across publicly funded programs, licensed child care centers, and also licensed child care homes, family child care homes. If you take a look at the table at the bottom of the slide, you can see the total number of sites and capacity by program type. If we just take a look and focus on capacity, we see that there are 232,921 slots in licensed child care centers and family child care homes combined, as well as an additional 41,752 slots in license exempt centers. However, this still leaves more than 654,000 children aged birth to 5 years old without a slot in a licensed center or home if they so chose to enroll their child in a child care program in the state. When we look a little deeper and look at the 102 counties in the state of Illinois, we found that 84 of these counties have no maternal, infant, and early childhood home visiting programs, also known as MCV. 65 have no preschool for all expansion programs, or PFAE. 44 had no license exempt child care centers. 42 had no early Head Start programs. 34 had no prevention initiative programs. 13 of these counties had no licensed child care centers or Head Start programs. 5 have no licensed child care homes available, and 2 counties had no preschool for all programs, although there were more than 20 counties, when you look a little bit deeper, that only had 1 or 2 sites across the entire county for preschool for all. Next slide. This slide shows a few quotes we received from community members, family council members, and parent caretakers in regards to their experiences and challenges with ECEC from various parts of the state. What is important to note as far as these quotes go, although they are from specific voices, they also represent very much shared sentiments of many families, caregivers, community members across the entire state of Illinois. And so some of the things that were kind of across the board were around finances and how to afford childcare. So the affordability factor, access. There was one community member that talked about having a program and then that program closed and left the area. So there were no options available in that particular part of the state. And then we have a parent that was sharing their positive experience and the thankfulness that they had around having a preschool for all expansion program, which gave them the ability to be able to work and bring in a second income and support their families better. And now I will pass it over to Angela Hubbard, who will discuss the community collaborations funding.
Good evening, everyone. I am Angela Hubbard. I use she, her pronouns. I am the Grants and Relationship Manager for Birth to 5 Illinois, and I'm happy to speak with you about our community collaboration work. Community collaborations are an integral part of the early childhood landscape, and the local early childhood community collaborations bring together community agencies, organizations, and individuals with a shared goal. They understand the importance of improving early childhood education and care for their children, for caregivers, and for providers. Birth to 5 Illinois was honored to provide $3.2 million in funding to 33 local early childhood collaborations in this past fiscal year of 2023. That included helping 9 newly developing collaborations gain their footing and get started. Up to $600,000 is now available in additional funding to help local early childhood collaborations, and the grant application for that is available on our website. You'll see a quote from one of our grantees that speaks to the importance of continued funding to local early childhood collaborations on this slide. Next slide, please. Collaborations used the Birth to 5 Illinois grants to meet a variety of needs. This quote from the Villa Park Area Early Childhood Collaborative describes the impact of their work to recruit and support multilingual community members to gain certification as translators. Some of the uses for funding that collaborations implemented were mileage for outreach. They paid for staffing. They were able to provide technology and compensation to parent ambassadors. They used the funds to convene and rent meeting space. And some of them used it for marketing and branding, and others made some targeted early childhood education and care workforce strategies come to fruition, like Villa Park that I mentioned earlier. So we were very pleased to support the work of the local early childhood collaborations. And if you'd like to learn more about that, please do visit our website. I'll pass it back to our director, Cicely Fleming, now to talk to us more about overall statewide needs.
Thank you, Angela. And so as I mentioned in opening, our 39 regional offices compiled or made these regional needs assessments. They came out in July. Hopefully you were able to access yours. And now we have compiled the top statewide needs. There were lots of themes across the 39 reports, and so we're gathering that here for you now. As you see on the screen, these were the top that came out of all 39 reports in some capacity, and these are some of the same that we have known about, but obviously now hearing directly from parents and providers, we know how important it is that we move our system forward. And so more affordable and available spots, a living wage for our professionals, and that also includes their ability to access benefits, medical benefits, and then more mental health supports for children and their families and providers came up across the state. Next slide, please. And then this slide showed you some themes across the state. Our state is very diverse, not only in the diversity in terms of the people who live there and their racial and ethnic and language, but you know, we have rural parts of our state. We have very urban and dense parts of the state. But what we saw when we talked to parents and providers was that they recognize the same needs throughout the system, no matter where they lived. And so we know that our state is working on a data system, and that was voiced across the land that we need more comprehensive data and access to that data. When parents and providers talked about CCAP, there's a disruption in care, particularly when parents are faced with the choice between having a raise that might be as small as $1 or $2 an hour and what that means for their CCAP subsidy and potentially losing that. And so we want to make sure that we're always addressing that need. Special education and the ability to have your child screened in a timely manner was heard a lot, that we need more providers, but also that the evaluation times need to be shortened so that parents can get their children evaluated and then ideally enroll into the services and supports that they need before they start kindergarten. As you heard before, workforce continues to be top of mind throughout our state. The compensation, also providers talked about being respected, so not being seen as babysitters or that their jobs are not important, that we value the work that they're doing every day in the classrooms. That licensing was brought up particularly by providers, that they want to make sure that there's transparency, they can understand those policies and procedures when their home is visited for licensing, that they are clear on what they need to do in terms of improvement so that they can open up and serve those families. Awareness. Families talked a lot about not being aware of what services and what programs they were even were in their community, let alone how they become eligible for them. And so that we as a state need to make sure we use very plain language, that we don't get stuck in the acronyms that we can use a lot in early learning space. And we make sure that we advertise far and wide in various mediums for all of our parents and families. That same mental, behavioral, and emotional health was definitely heard throughout our state as well. The access to services, the wraparound supports that families are looking for their children, as well as qualifying. And so again, looking at those price points, and so people can qualify for any kind of subsidized or state supported services for their families. Transportation was a huge need, particularly in our rural areas where we don't have public transportation opportunities. That parents talked about, maybe there is a space available for their child, but they can't get there simply because either they don't have a car or they work in a different direction from where their care is provided. And so making sure when we open up new care facilities that they are in a space that parents can actually access, and we consider areas that do not have public transportation. And language, again, that we make sure as a state we're producing things in the languages, the home language of parents. And so language came up not only from materials, but we want to have staffing that can speak to parents in their home language, and that we make sure those language materials, as I mentioned earlier, are accessible, and so that the reading level is that we pay attention to reading level, and so that everyone, no matter what their schooling background is, particularly in English as second language learners, that those materials are available for them to access as well. Sonia is now going to go over recommendations, which every regional needs assessment did have needs and recommendations. So she's going to give you the high level view of those.
All right, thank you, Cicely. So the needs and recommendations go hand in hand. And so for all of those needs, we have some recommendations that kind of go along with those. And as far as like the overall top recommendations that we saw across the state, here are a couple of them. So first was around creating sustainable aligned funding with a focus on increasing programming overall, especially for families of 0 to 3-year-olds. That came across loud and clear that we needed more programming to service families that have our earliest learners, the 0 to 3-year-old population. Also, increasing compensation. Of course, everyone is aware of that we need to increase compensation and make pay parity and equity a priority, with some statewide salary guidelines that include annual increases and incentives for early childhood education and care staff. And also includes benefits. A lot of our staff work and are not afforded the opportunity for benefits like sick, vacation, medical, and retirement. So that was another recommendation that came out loud and clear across the state of Illinois. Also increasing ECEC, or early childhood education and care, collaborations across the state. Angela talked about the funding that we provide to early childhood collaborations across the state. And so there was recommendation that we increase that across the state, because most of the state does not have such collaborations in existence to provide that additional level of support and advocacy and support to families and providers in those respective parts of the state. Also, improving public-facing data systems that have more robust current and point-in-time demographic data, and also include provider and program quality data. So for the regional needs assessments, we use the most recent available publicly facing data, which was from 2021 at the time. And so having more current demographic data or program data and quality data came across loud and clear. There was also recommendation for consolidating aggregate data across blended and braided funding sources, and that also can track program capacity and wait lists across programs. And then finally, streamlining offerings within early childhood education and care programs, and increasing awareness for families that may benefit from these services. But not only families, also we found professionals within early childhood education and care system, and those in related fields that service the same families needed increased awareness of the programs that were available, so that as they had those contacts with those families, they could recommend and refer to those services that they would be eligible for. Next slide, please. And so here are some more shared themes across the state. This first one really focuses on creating, expanding, and improving programs, which includes making more publicly funded programs available across the state. Again, as I mentioned earlier, especially for the 0 to 3-year-old population, and also of concern and of high need is in rural areas across the state as well. For special education, recommendations included increasing accessibility to developmental screenings for children at an earlier age so that we are able to identify needs and intervene sooner. So increasing the access to those developmental screenings at a younger age came across a lot across the regions and across the state. Increasing availability of inclusive care for children with disabilities, with an emphasis on having more specialized professionals in the classroom. And when I speak about specialized professionals, specifically like paraprofessionals or speech language pathologists, just for example, having those professionals available to provide some additional technical assistance and support. And also specifically providing more special education, professional development for classroom and program staff so that they are better equipped to care for these children. In regards to accessible grants and other funding supports, making funds available to support a variety of full-day programming that include different types of care, expanding locations, and making them more available location-wide and geographically wide to meet the needs of families. Also allowing more creativity and funding, for example, expanding grant capacity so that programs can offer true full-day options for families that extend to before and after school care. Also allowing more flexibility with funding rates that would include an annual cost of living adjustment, for example, to cover regular pay increases for staff and increasing operational costs for programs year to year. Another example would be making grants like the Child Care Restoration Grants, the Workforce Bonus Program, Now Strengthen and Grow Child Care Grants available for multi-year cycles for longer sustainability in programs. Next slide, please. In regards to CCAP, recommendations included increasing the pay rate for second and third shift care, and having an increased rate that was above the other pay rates, that first shift pay rate, so that it would incentivize more providers to offer care for second and third shift care, streamlining that application process for families, and thinking about having that single application portal system so that families aren't having to fill out multiple applications to receive services and programs, and also applying for CCAP at the same time. And then finally, to continue to expand the income eligibility so more families continue to qualify for the CCAP subsidy. Recommendations for language included enhancing the offering of comprehensive language supports to families that speak other languages. And that included interpreters and translation provided by culturally responsive providers. And also, again, revising application processes for all services within ECEC, which include the CCAP application, individual education plans, for example, were some of the other areas. And Cicely talked about that in as far as the needs around language as well. Transportation came up as a barrier quite a bit across the entire state, as Cicely said, specifically and more widespread within the rural communities. So recommendations for improvement in this area included making more funding available to support the cost of transportation to programs. For example, having partnerships with school districts and other community partners, There was also a need for funding for programs that currently provide transportation to update their current fleets that they have and be able to do more maintenance on those. There was also recommendations for the state to explore different ways of meeting transportation needs and looking at alternative service delivery models to meet the needs of families. And finally, recommendations for DCFS included increasing supports to those home-based providers with more consistent enforcement during monitoring across licensing representatives in the state. So that was kind of twofold. And with the home-based providers, specifically we're providing more technical assistance about meeting licensing standards. And then also for those that were interested in creating new home-based or family child care programs. And then also for the monitoring piece, that was more specifically around having more consistent and transparent enforcement across the licensing representatives across the state of Illinois. It was found that different licensing reps enforce the licensing standards differently. And so that was something that was brought up quite a bit throughout the state as well. There was also a recommendation to improve the vouchering system and the approval times for that so that more providers would be willing to take children in DCFS care. And this could also impact and incentivize more families to foster children if more options were available for child care. And that barrier was kind of removed from them being able to care for and take in youth in care for DCFS. So again, these are just a summary of recommendations. Of course, if you're interested in more detailed information, I encourage you to read the state report, or if you're looking for more specific information according to where you live or work, you can read the regional needs assessment that covers your area. And now I will turn it back over to Sophie, who will discuss our next steps.
Thank you, Sonia. This summer, regional teams went into their communities, talking to more families, providers, and stakeholders about their experiences with early childhood education and care. Additional information is currently being put into an addendum report, which will be posted on the Birth to 5 Illinois website in November. As we share our early childhood regional needs assessments with the communities across the state, we continue to amplify local voices and map the next steps for our councils in year 2, during which we will gather community input and create regional action plans to begin addressing the needs and recommendations identified, expand our first-year analysis to include mental health support for families and early educators, as these were noted in every region in Illinois. Maintain and build local partnerships and relationships to support our mission of mobilizing communities in the development of equitable access to inclusive, high-quality early childhood services for all children and families. We invite community members, families, and early childhood professionals to get involved in the work of their local councils, support the development of our action plans, and include their voice in year 2 by visiting our website, www.birth-to-5il.com/councils. From there, you can get in touch with your regional council manager. And now I'm going to turn it back over to August, who is going to help close things out before we transition to the Q&A portion of today's meeting.
So we want to thank our state partners for their support and thank all of you for attending. Next slide. We encourage you to stay in touch with us by visiting our website, www.birth-to-5il.com. You can always send questions to info@birth-to-5il.com. We invite you to sign up for our mailing list to receive our monthly newsletter, and we'd also love to connect with you on social media. You can connect with us on any of the platforms you see here. They're going to be typed into the chat for you. Thank you so much for your time. We look forward to connecting with you soon.
Good evening, everyone. My name is Maggie Kohler. I use she, her pronouns, and I am the communications manager here at Birth to Five, Illinois. We are going to be transitioning to the question and answer portion of tonight's session. For anyone who has joined late, I'm going to drop into the chat a reminder that we do all need to select a channel tonight. So whether that channel is English or Spanish, if you go to the bottom of your screen and choose a channel, you'll be able to hear the question and answers. Want to say thank you to anyone who submitted a question in advance. We are going to start by answering some of those questions, and then we'll move into live Q&A. So first question, given the complexity of the results of these reports, what are some of the implications and what are the intended consequences? Cicely, do you want to answer that?
Sure, thank you for asking. So, as I mentioned before, we were kind of birthed out of the commission report from 2021, in which it was recognized that there was really at that time no way for the state to understand what's happening in the local level across the state in regard to early learning. So these reports were put together to kind of start that work and lay some groundwork for state leadership, DHS, the governor's office, ISB, to really have a better understanding of what the needs are. And so that we hope that we've produced reports that will allow them to dig deeper and understand when they're looking at opening new services, expanding services, where the workforce might be needed for EI versus, another scope of work, that they can understand that on the local level. And then as state leaders, they can start to allocate funding appropriately based on what the needs are in the community. And so while we don't necessarily have a direct say in those things, we are confident these reports paired with the funding that's coming out with Smart Start Illinois, that we will start to see some changes in communities sooner than later.
Thank you, Cicely. The next question actually was about funding. So if we can pivot there, the question was, are there any budget initiatives being presented in order to reach larger groups of families in the early childhood space?
And so I will go back to, there's throughout the pandemic, we saw lots of changes. Sonia mentioned some of them earlier regarding I'm sorry, I lost track. The Strengthen and Grow grants and some other stabilization funding that went out to really support providers. And then there were also changes to CCAP, and so that it allowed more families with what would have been higher incomes to now be eligible for CCAP support. Throughout the Smart Start Budget Initiative, which we, if you want to email, we can share with you directly, or you can, I'm sure, find on the governor's website. There are lots of dollars that are going to go really targeted towards families who before maybe we would have, not qualified based on poverty rates, but the governor is putting more money into different programs to really meet those needs. And so there are a variety of things. Again, those are kind of trickling out now. Smart Start Illinois was just approved in this last budget year, but definitely can kind of try to direct you. I think Maggie's putting something in the chat now for you, and try to direct you to that information later after the presentation to kind of show you what that is. I cannot say because it is not under my work purview exactly what those things will be and when you will see them, but we are very hopeful that they are coming soon.
Thank you, Cicely. Another question submitted before this evening's session was from someone asking about what small business owners can do to be heard and to support early childhood.
I can take that one again. Or Sonia, you want to take that one?
Sure. Sure. So, as you may or may not know, one of the stakeholder groups that we are engaging within our regional councils, regional action and family councils, are folks from the business community. So that is one of the stakeholder groups that we are very much trying to engage in our work and helping us find solutions that meet the needs within each one of these regions. So you're more than welcome to reach out and look up and see which regional office covers your area and get engaged with them in that way. And then there's also a group, I believe it's Ready Nation. And so they are a group that's working specifically with business owners across the state, and they have some work groups going to also think about how we can support early learning in the early childhood education and care system. So I believe we have that information too, that we can also drop the link to their webpage, which is readynation.org. So you can also get involved there with other folks within the business community that are talking about early childhood and doing some problem solving there.
Thank you, Sonia. Pivoting a little bit to grants. So there were some questions submitted. Are private schools and 501c3 entities eligible to apply? If I'm a home daycare provider, am I eligible? Angela, can you speak to that?
Well, that's my cue. Yes, I can. So we understand there are a lot of worthwhile causes and many needs in the early childhood space. Our grants are specifically for local early childhood collaborations. They are not intended to go to providers. They are not to increase slots. We know there's a huge need for that, and we try to share information about other opportunities as they come to serve those needs. But our grants are right around systems level change. So we're looking at groups who are working together to improve early childhood care and education for whatever system they're working on, whether it's a neighborhood, a specific group, a population of people, a county, a region. So those collaborations work to partner with various people within the community, whether it's providers, family members, therapists, programs. They're all included in working on those things, and that's what a collaboration is for us. That's what our grants go toward. To answer that other question, yes, a 501c3 or a private school can apply as a fiscal agent, and they would be, again, part of a larger group of people working toward that end of increasing and improving their enrollment in early childhood education and care programs and services. They would not get the funding specifically for that program or that school. So it would not fund a teacher, it would not fund additional slots or services, but it would fund the collaboration that they would be a backbone agency of.
Great, thank you, Angela. Before we wrap, we have a few other questions to go through. I just want to invite folks to drop any questions into the Q&A box that you have, and we'll go ahead and answer those live in just a few minutes. Or you can raise your hand and come off mute to ask a question in a few minutes as well. Okay, so two more questions. Someone asked a specific question, what are families saying in Whiteside? So for just that specific question, I'll just pop into the chat that there's a Region 47 report that covers Lee, Ogle, and Whiteside counties. And there is an individual needs assessment report for each of the regions of the state. So again, tonight we're presenting a statewide summary, but there is a drill down in each region, which was the foundation for everything we're discussing today across the state. Other question, what, if any, is the mechanism to transform the recommendations into legislation or policy changes? I don't know, Cicely or Sonia, if you want to handle that.
I'll take that one again. So we, as a department, don't have a mechanism. We were charged with, providing this information. We have provided it to the Illinois State Board of Education, as well as the Illinois Department of Human Services under their Division of Early Childhood. They are our funders, who August thanked earlier. We have provided to them. We have made several presentations kind of in different spaces. And so our role is not really legislation, right? And so there are advocates around the state who do more of that lobbying for legislative change, and they are also aware of the needs, and we will continue to share with them what we're learning from the community, and then our hands are out of it. And so As we've talked about our action and family councils, our regional staff are definitely engaging with their local, with their county, and with their state elected officials and presenting them with this information as well from the community level. And then it is a kind of our hope that they will take that forward in their role as legislators and make the appropriate change.
Thank you, Cicely. This wasn't really a question, but just someone submitted a comment about, a program wanting to open up more slots, but they're kind of balancing between paying staff salaries. And I just wanted to share that, at the regional level, our staff and our regional offices and councils are examining the reasons for the slot gap. So we know in some cases it's location, in others they're finding out it's a cost issue. And so again, looking at the data locally within each region gives us a picture and gives decision makers a picture of what the issues are, rather than just saying we need more slots, right? It's kind of drilling down and figuring out what that looks like at the regional level in order to better support providers and obviously create more early learning experiences for children. Well, with that, those are all the questions that have been submitted this evening. I do want to pause and do one more call if anyone would like to type a question into the Q&A box or raise their hand to come off mute and ask a question. And if that is not the case, we extend our gratitude to each and every one of you for joining us this evening. Thank you for your participation and engagement. We look forward to, there is a follow-up question. Tanisha, do you want to come off mute and ask, or do you want to just type it into the Q&A box? All right, I got you. Hold on one second. Amber, are you able to unmute?
Yes, it says Tanisha is unmuted.
Good evening. Can you guys hear me okay?
Yes.
Okay, great. I'm not sure why the camera isn't working, but I just had a follow-up question. I did have the question pertaining to the 501c3 and private school, and I just want to make sure that I clearly understand that. When you were saying that entities like ours would be eligible from more of that collaboration standpoint, can you just give a little bit more clarity around that so I just really understand kind of how to move forward in it?
Sure, of course. And you're also welcome to follow up with me after the webinar and we can speak directly about specifics.
Okay.
But in general, say you're a private school or a 501c3 and you'd like to serve as a fiscal agent for a collaboration, which means you would be the organization accepting the money. You would also be the organization reporting to me about how you're spending the funds, but your role is not just for your school or your organization. Your role is for the entire collaboration, which would be a group of however many people working on, let's say you're working on, let's use Whiteside, for example. We spoke about that. We're talking about Whiteside County, and you're thinking about how do I improve services and programs in Whiteside County? Well, let's see, we need some people who are providers to come in and tell us what's existing and what the holes are. We need some caregivers to tell us what their barriers might be. And maybe we also need some business people to be on our collaboration to figure out, are there some incentives that they can give to their employees, or that they can support some slots or programming even. And so that whole group would be a local early childhood collaboration working toward this. You could use the funding for staffing. You could say, oh, this staff is specifically for this collaboration versus this staff person is for the school. So does that help?
It really, really does. Thank you so much. And Angela, if I am able to follow up with you independently of this, that would be amazing.
Absolutely. And everyone is able to reach us through our grants@birth-to5il.com email. That also comes to me. So I'll be the person responding to you, but that's just an easier way for us to make sure we don't miss grant related questions. Thanks so much.
Thank you.
All right. Thank you. So now this concludes our program this evening. Thanks again for all your time, and we will send an email out in post with some additional links and resources. Thank you all so much. Have a great night.